More than 3,000 American youth try marijuana for the first time every day. More teens use marijuana than cocaine, heroin, ecstasy, and all other illicit drugs combined. The number of 8th graders who used marijuana doubled between 1991 and 2001, from 1 in 10 to 1 in 5. Each year, more kids enter treatment with a primary marijuana diagnosis than for all other illicit drugs combined, even more than for alcohol. In the movies they watch, in the songs they listen to, on the clothes they wear, and even on the websites they visit, American teens are getting the message that marijuana is okay. And despite mounting evidence that marijuana is harmful, they believe what they're hearing.
I don't think that marijuana is addictive.
It's good that it's finally being brought into the mainstream and people are getting to see that it's not as bad as it's once thought it was.
I haven't heard anything that it's addictive. I haven't been shown any evidence that it is, so it's just my general understanding that it's not.
I think our culture consistently sends difficult messages to our children about marijuana. Young people have heroes, and sports figures or movie stars are often those heroes. And we hear them talking about their use of marijuana. We hear jokes on late-night TV about marijuana. It's something that is a source of humor. Well, that's a very mixed message.
It's true that many teens and their parents may not be getting the full story on marijuana. A recent review of news coverage about the drug found that only 6% of the stories address the actual harms of marijuana use. So, what should your community know about this drug? Myths abound about the so-called harmlessness of marijuana, but the facts show it puts teens at risk. Fact number 1. Marijuana is addictive. Nearly 60% of teens who enter drug treatment each year do so with a primary diagnosis of marijuana dependence. And marijuana use is 3 times more likely to lead to dependence among teens than among adults.
Teens that come to treatment for drug abuse, the great majority of them have problems with marijuana. So marijuana is the primary of drug abuse for most teens that seek treatment. By far, it's more prevalent than any of the other illicit drugs.
Fact number 2. Marijuana hurts young bodies and minds. 1 marijuana joint contains as much cancer-causing tar as 4 tobacco cigarettes. Marijuana also affects the brain and can impair mental health, leading to depression and anxiety.
Many parents remember their marijuana days of 20 or 30 years ago, and what people fail to recognize is that the marijuana today is much stronger in terms of those mind-altering chemicals, the tars, the carbon monoxide, so that it not only injures the brain, but it also injures the lung as well.
Fact number 3. Kids who use marijuana are more likely to take risks. Research shows that kids who are high are more likely to have poor judgment, leading to sex and other risky behaviors. Fact number 4. Marijuana impairs driving and puts teens at risk. Marijuana slows reaction time and impairs the skills needed for safe driving. Teens who ride with drug drivers are also in danger. Fact number 5. Marijuana use can jeopardize teens' futures. Kids who use marijuana on a regular basis are more likely to fail in school. Teens who use the drug may also get in trouble with the law, lose scholarship funding, or athletic eligibility.
Pop culture tends to trivialize the threat posed by marijuana. Marijuana is a source of dependency in too many cases for young people. It's a source of poor performance in school. It's a source of encouraging risky behavior, even violent behavior.
So, now that you know the facts about this drug, you might be asking yourself, what can we do about it? We can start by working together to debunk the myths about marijuana.
Communities, I feel, need to work together to address problems. It shouldn't be an individual. It should be everyone working together, because all of these kids are part of the community.
Well, I think that we have proven again and again that when we address the problem head on, we have an impact on the problem. And from 1977 until the early 1990s, marijuana use decreased by 50%. That didn't just happen. That wasn't something in the air. That was a consistent strategy by the entire community, by government, by education, that gave young people clear messages, the facts, and the skills to resist.
The only way this is going to be successful is if we have all aspects or all members of our community get involved in this effort. That includes the churches, small businesses, big corporations, the faith community, our school districts, the nonprofits in the city, the Boys and Girls Clubs, and individuals, parents, families.
No one entity can change the situation alone. We're going to need every resource available to help our youth.
So what can sectors do? Well, the police department certainly has a vital role. They can provide accurate information on the problems they face with marijuana abuse. Faith communities, the pastor from the pulpit can tell parents that it's vital that they parent, and that a part of parenting today has to be discussing drugs, specifically marijuana, with your young people. The business community. Parents don't get parenting education like they once did. So if a banner comes across your computer that says signs and symptoms of adolescent drug abuse, you are getting education as a parent to help speak with your children.
Communities can also start by educating parents. 2/3 of teens say that losing their parents' respect is one of the main reasons they don't use marijuana. Parents can keep their kids drug-free by knowing who their friends are, how they're spending their time, and setting clear rules. And parents can also help by getting involved in their community. The National Youth Anti-Drug Media Campaign offers free materials that you can use in your community to address teen marijuana use. To learn more about these and what you can do, visit MediaCampaign.org or call the National Clearinghouse for Alcohol and Drug Information at 1-800-788-2800. Information about marijuana and advice for parents on raising drug-free teens can be found at theantidrug.com. Information is also available in Spanish and several Asian languages through the website. Information for teens is available at freevibe.com.